Let's talk about Achilles tendon ruptures. I'm Dr. David, orthopedic surgeon, sports medicine specialist, and author of That's Gotta Hurt, The Injuries That Changed Sports Forever. I provide education, information, and commentary on all sorts of sports and exercise injuries, injury treatments, and injury prevention for athletes and active people so that you can stay healthy and perform your best. One of the most devastating injuries that an athlete can suffer, anywhere from the pro athlete to the weekend warrior, is an Achilles tendon rupture. The Achilles tendon is the tendon on the back of your heel. Basically, it connects the calf muscle to your heel bone. What typically happens is that you go to plant your foot to push off into a sprint and just pop. Feels like somebody hit you on the back of the ankle, or a gunshot, bullet fire hit you, something like that. A lot of times people will tell me when they're in my office, they'll say they thought they got kicked in the back of the ankle. They turn around to look to see who kicked them. There's nobody there. Really, really traumatic injury, and it really hurts. And it's really difficult to play sports until that heals, and certainly until you fully recover. Now, there's a lot of questions as far as how you treat it, but before we get to that, let's talk about kind of signs of it. Usually, right after it happens, you can feel the gap, you can feel the defect. Plus, it's hard to walk, it's hard to push off, so going to see the doctor can be helpful. A lot of times, we won't even get an MRI because the diagnosis is really, really obvious just based on physical exam. But sometimes if there's a question, is it partial tear, something like that, an MRI can be helpful. Now, the question then gets to, do you do surgery or no surgery? And it depends really on who you ask. Some studies show pretty equal success rates in terms of healing. There were some studies in the past that showed higher re-rupture rates or re-tear rates in the group without surgery, but there's been some question about that. Typically, if you're super athletic, you play pro sports, still the trend is to fix those surgically. You make an incision, you sew it back together. There's ways to do it through smaller incisions, or sometimes it's an incision about that big. And you sew it back together, and then you let it heal. And you basically immobilize it for 10 days or sometimes several weeks, and then you start to get ankle motion back and slowly work to get strength back. Now, it's not a quick recovery. At the pro sports level, it can take anywhere up to 6 to 9 months sometimes, but it's a gradual progression. You keep working on it with physical therapy and slowly work your way back into sports. But again, it's a long time before the injured one feels like the uninjured ankle, so you need to know that. Now, non-surgical treatment's probably about the same length of time. Might be a little slower on the front end, protecting the repair and getting it to heal without surgery. But again, do you need surgery? Do you not? Talk to your doctor. Discuss your age, what you do at work, that kind of thing, what your activity levels are in terms of sports and exercise. Decide what treatment option is best for you. All right, did this video help you? Do you have an Achilles tendon rupture, or have you had one? And how did you treat it? Did you have surgery? What did it take to get over it? I'd love to hear your experience. So in the comments below this video, describe your experience. I can't answer legally specific questions that you leave in the comments, but I do read them and potentially address those in one of my podcast episodes, or at least like to hear your comments and get kind of your experience with these. All right, I would love to know the biggest challenge you face with your injury, whether it's Achilles tendon rupture or some other injury. In the description below this video, the very top link is a link that takes you to my website, where you've got basically all sorts of room to describe the biggest challenge that your sports or exercise injury is creating. I use that information to basically understand what you're going through so that I can design videos, articles, and even courses to better help you. So it really helps me know what content to deliver for you. Alright, if you like videos like this and you want more information on sports and exercise injuries, injury treatments, and injury prevention, subscribe to my video channel. You'll get the videos I do every single week delivered directly to you, plus you get notified when I'm on YouTube Live so that you can comment or ask questions about whatever I'm talking about. So click the subscribe button in the upper right corner of the page and you can get those videos directly to you. Thank you so much for watching. Really hope this was helpful. I'd love to hear about your Achilles tendon rupture, so leave those comments below, and I look forward to seeing you right here next time.